Welcome, and tell us a little bit more about your field of study and academic work at UC Davis, and really what led you to study the mental health impacts of anti-Semitism.
Excellent. Well, first, thank you so much for having me. As we were chatting before, this is actually the first time that I'm getting a chance to publicly talk about my work, and so I am really excited to share this. My goal as a researcher is not to have research just talked about amongst sort of the three or four researchers that do the work, but really to make sure that the knowledge gets out to the public and to practitioners. So thank you for this opportunity. I'm trained as a stress researcher. Stress has widespread implications on the body and impacts cognitive functioning, mental health, physical health. And so, as a stress researcher, I've looked at a wide range of outcomes, but the stressors that I've focused on in the past have been poverty, violence, um, intimate partner violence, violence against children, and then also most relevant here, discrimination. So this is the first study that I've done that is focused on anti-Semitism, but my work across the last 15 years has really built a foundation for this work in understanding the stress processes. And anti-Semitism, while a unique stressor, does not manifest completely differently than other stressors that we see. And certainly we don't see anti-Semitism impacting Jews in a vastly different way than how we see anti-Black racism impacting Black communities. And I've done sort of an area of work specifically in Latino families, looking at poverty, acculturation, and discrimination. And this sort of builds off really nicely from those previous studies. But I didn't sort of naturally, I guess, step into this space. You asked how I started. What led me to study mental health and anti-Semitism, and actually it was my personal experiences with anti-Semitism that made me step into this space. And so, as somebody that has focused on discrimination in other communities, specifically, like I said, in the Latino community, I applied for and got onto my school district's, my kids' school district's Ethnic Studies Advisory Board. So many of your listeners are probably very familiar with some of the issues, in particular with anti-Semitism within ethnic studies. But when I actually first got onto that board, I sort of knew. I had heard some rumblings about anti-Semitism and ethnic studies, but I got onto that board not because of an interest in anti-Semitism, but because of my expertise with Latino families. So I got onto that board in 2021, and whoa, was that eye-opening. I was um, exposed to all sorts of anti-Semitic tropes and accused of malice just for being a Jew in that space. And so, somebody who studies stress, my first thought was, wow, this is really stressful. And then, well, what do we know about anti-Semitism as a stressor and how it impacts Jews? And so, when I went to the literature, my my jaw just dropped open exactly what you had led into this conversation with of looking at education journals. It's the same when we look at stress journals. It's the same when we look at broadly at child development journals, family journals. There just is so little research about anti-Semitism and the impact on Jews that's contemporary. There is a huge amount of research on Holocaust survivors, but not about contemporary anti-Semitism. And so I felt with my expertise well positioned to sort of step into this space.
That's great. And I think many of us had these experiences, particularly post 10/7, but even before 10/7. And I think that really expanded many people in our community's interest in being more involved Jewishly, being more, involved in the community and working on these issues. So that's definitely a common story. Um, so why don't we turn to the study itself? So tell us a little bit about the study, what methodology you used, how did you find the subjects, what format did you use? Kind of paint a picture for us of what the study was, and then we'll talk about what the study actually said.
So after realizing what a gap there was and knowing that I just felt really, really compelled to start up a project right away. But I didn't have any funding. And so the project was very shoestring budget. Typically with my studies, I have them longitudinal. I'll do in-home visits. I'll collect biological measures. With this being without any type of funding, just my own funding. What I did was sent out a questionnaire on an online platform, and I just started reaching out to as many Jewish communities that I could find. And so, PJ Library, BBYO, I was knocking on doors of synagogues all across sort of Northern California and in the Bay Area, just trying to see if anybody would be willing to send out this link that I had. It was just a link, and I did compensate participants, but really not very much. $10 to fill out the questionnaire. Um, and that was all before October 7th. And it was really just in my head, it was kind of like a kitchen sink, right? Wow, we don't really know anything about how anti-Semitism is impacting Jewish parents, in particular, their mental health, their understanding of their own Jewish identity, how they're talking to their kids about instilling a Jewish identity, how they're talking to their kids about anti-Semitism. And so it was a pretty broad study to kind of see what would stick. And then the other thing that was sort of tricky in doing this is that because there has been so little research in this area, we really don't have good questionnaires. We actually now have in the 2 years since October 7th, there's really been a growth of research in this space. But before this, we did not have good questionnaires that had been validated in Jewish communities. And what I mean by that is to say that we know that these questionnaires kind of work to assess what we think they're assessing. And
Mhm.
so, actually, in the papers that I'm publishing, part of what I'm doing is even just validating, is saying, well, we use this questionnaire, and based on the statistics, it seems to be functioning as expected. But what I did is I drew upon surveys that had been used in other communities and modified them to sort of tap into the Jewish experience. But basically taking standardized questionnaires of depression, standardized questionnaires of ethnic identity, standardized questionnaires of socialization of ethnic identity, of how parents teach ethnic identity, questionnaires again that had never been used in Jewish communities but had been used in other communities, and push that out to as many Jewish communities as I could find.
And you mentioned you were doing this before October 7th. So then October 7th happened. How did those events impact the way you were in the middle of the study? So how did that impact the way you conducted your study?
Yeah. So we actually were right at the beginning of the study. We launched data collection September 6th of 2023. So we had been collecting data for about a month, almost exactly a month. And actually, I talk about, going out, knocking on doors, seeing who would respond, but actually in that month, recruitment was a breeze. I was shocked at how quickly people signed up. My sense was is that people were really hungry to talk about these issues. Parents were hungry to tell us about how they were feeling about raising Jewish kids in this world right now. Again, this was before October 7th.
Mhm.
But in that time, in that first month, we ended up recruiting close to 100 families. And that's, and I just want to also, say again, I had no budget. I had no staff. Like we didn't have recruiters out there. This wasn't like the census. We didn't have, a team of people that were going out and knocking on doors. It was really me. Um, I say we, I had some undergraduates that were helping. I had another professor colleague that was doing some in-depth interviewing after October 7th to talk to people more in more depth. Um, but once October 7th hit, I I wasn't thinking about the study. I mean, like like many people, I was just in such horrific shock. Um, and then forced into the world that was UC Davis.
Mhm.
Um, so 3 days after October 7th, a professor in the building that I work in tweeted that she wanted to find and kill Zionist journalists and their children. We had pro-Hamas teach-ins, horrific rhetoric and protests that were happening on campus.
Mhm.
And so um, immediately in the aftermath of October 7th, I was a participant in my own
Mhm.
research, right? I was consumed in it as well. And then I also just realized that there was no way that I could really be reaching out to Jewish communities, asking them for favors. Um, that it did not, and I realized I didn't say this in the outset. I am Jewish, for this, Karen, but I realized that I did not say that for the people that have joined the call. Um, uh, but I knew that Jewish communities were in such crisis that for me to try and make an ask was going to be very difficult. But then I realized that if I did not start collecting data, I was going to be missing one of the most important experiences in contemporary Jewish life. This was the largest modern crisis that modern Jews have experienced. And and collecting data was more important now than ever before. And because we had already started collecting data, we were in this really, really unique position. So you will see some more anti-Semitism research that's coming out now, but almost nobody has a design like we have, which is a pre-post design. So we started collecting data September 6th. At the end of October, I realized, this urgency to get back into data collection. And the first thing that I did was reach out to all of those participants who had already responded to our survey and ask them to fill out the survey again. In this way, what we did is we followed the same Jewish individuals over time, from before to after, from immediately before to immediately after October 7th. So you can think of this like taking somebody's temperature when they're healthy and then taking their temperature when they're sick. It shows us that's how that same person has changed across this insult, injury, or crisis. It is a really powerful design because each person serves as their own comparison, as their own control. But then we also continued recruiting new participants. And what this means is that we were able to compare different Jewish people from before October 7th to different Jewish people after October 7th. And so this is like comparing the average temperature of healthy people to the average temperature of sick people. It allowed us to collect a much, much larger and more diverse sample. Um, But having these two sort of designs within one study it shows us that these findings are really real because they show the same thing. We found the same findings for our within sample as we did with that between subjects, the two sets of different participants across time. Um, and so we can say in a very scientifically robust way that Jewish mental health significantly declined across October 7th.
What was the total number of subjects that took the
Um, it would at the end, I think it was 218
218?
was our total sample. Yes. So still, for those of you that are used to looking at really large studies, it is not a super large study, but our effect sizes are quite robust. So it's not a large study, but it's basically two studies in one, and our findings replicate. So our findings are quite robust.
And how long was the survey that you did?
Um, it I think it took about 45 minutes
Okay,
or
so very in
so.
depth.
Yes.
Yeah.
Yes, for people to get through. Yeah. And like I said, when I first started the study, it was like, okay, we really don't know anything. Oftentimes for those of us in 2025 who are researchers, we're building off of decades of research. We really know what it is that we're going for. With this research, there has been so little done that yes, we have foundational research on stress and discrimination and intergenerational processes. But in terms of knowing this information in Jews, the field is wide open.
Mm. I mean, if you think about it, over 200 people taking a 45-minute plus survey is pretty impressive.
Yes. Yeah, Qualtrics always tells me that. It's always like, this survey is too long. And I'm like, I know, but we need to know.
So let's talk about the results. What was the picture that it painted about mental health of Jewish families in California?
Um, so the data show everything that we've kind of been hearing anecdotally. We found statistically significant increases in depression and anxiety from before to after October 7th. And when I say statistically significant, what I mean is that this difference is real. It's not just anecdotal. It's not a coincidence. It's something that we can, by using a statistical test, be able to verify that the difference is real and that there is an increase from before to after. And we see this increase again in both samples. So we see in a strikingly, a really, really high increase in depression and anxiety for that smaller within group sample. And then we see not quite as high in the between subjects, larger sample, more diversity in that sample, but still profound, very, very high. We saw increases of about 50 to 100%. So,
Mm.
depression rates doubling from before to, or symptoms of depression and anxiety doubling from before to after October 7th. And we were able to look at because of these different designs in this kind of the pre-post, we were able to look at, is this because of October 7th, or is this because of anti-Semitism here within the United States? And in other words, are Jews within the United States having a traumatic response from the events unfolding in the Middle East, October 7th, the horrific war that we have been seeing play out on social media and on the news? Or is it what's going on in the United States? Is it anti-Semitism here? And what we found is that it's anti-Semitism here. It's people's concerns about anti-Semitism that is really driving that increase in depression and anxiety. It is anti-Semitism that is causing this increase, that is driving this increase in mental health problems, not um, not just again this sort of the crisis in the Middle East.
So let's talk a little bit more about that particular point because when I looked at your study, these are one of the points that really stuck out to me too, was that concerns around rising anti-Semitism. So that anti-Semitism that we're even seeing, maybe not even, that we're directly experiencing, but that we're witnessing, we're part of, we're seeing everywhere,
Yeah.
actually has that kind of impact. Can you talk a little bit about like why is that? Why is there an impact, and why do you not have to experience something directly to actually be affected by it?
Yeah, so the people really talked about this undermining of their safety and security. And what you said is exactly right. They didn't have to directly experience anti-Semitism to feel this impact. And and actually, I'm going to step back and just also say one thing, which is that concerns around anti-Semitism are very, very high. And so we did, there are some people in our sample that are not concerned about anti-Semitism. They are very few and far between.
Mhm.
It's something like 75% of our sample is in that, you know, very to extremely concerned with anti-Semitism. And I think that that is notable because typically when we're running our statistical tests, what you're looking at is does variation in one variable explain variation in another variable?
Mhm.
And the fact that we have very little variation in our concerns around anti-Semitism, and yet it still is a powerful predictor for mental health. Again, I think it just echoes this robustness of the finding. People are very concerned, and still individual differences in those levels of concern do have notable impacts on their mental health. Um, and so back to answering your question of kind of what is going on here. This is not something that we assessed because by and large, I kept the survey the same after October 7th as I did before because I didn't want to do anything that might jeopardize that pre-post
Mhm.
design. But I think as we all were kind of living in the aftermath, um, the listeners, we can think about things that would have been important for me to put in there. For example, I think many of us were surprised at how some of our friends responded.
Mhm.
And so it wasn't necessarily that our friends did something directly anti-Semitic to us.
Mhm.
But maybe they didn't reach out, or maybe when, we posted on social media something that had happened, none of our friends engaged with that. No, nobody talked to us about what was going on. And we know that a huge buffer of stress is social support. And so not only did we see this increase in stress, I assume that a lot of that sort of unchecked increase in stress is because many, many Jews lost their social support systems. That's something that people talked about when we did those interviews is losing friends. People talked about feeling abandoned.
Mhm.
Um, and so I think that sort of fed into people's concerns, not only am I scared about anti-Semitism, but I don't feel like there's anybody that's got my back. There's nobody that's going to protect me. And I think that that was particularly undermining for mental health. But again, that's not something that we assessed. I wasn't thinking about social support when we started this study. But it's actually, and I'm happy, later on to talk more about, sort of next steps in my research and other studies that I'm planning. But I want to dig more into this idea of social support and loss of community. I think that what we found is we did assess Jewish identity and connection with Jewish identity. I have a paper that's under review right now. You can search it and find it. It is posted where we talk about how ethnic identity increases across October 7th, meaning that
Mhm.
in the aftermath of October 7th, people feel more Jewish. They feel more strongly identified with their ethnic identity. And they're seeking out Jewish cultural experiences, right? And so my guess is that while many people have seen a decrease in their non-Jewish communities, a decrease in social support from their non-Jewish friends, my guess is that in seeking out Jewish cultural experiences, they're also seeking out Jews, and
Mhm.
they're seeking out people to be with. And I think that can be a really um, powerful buffer for some of these mental health impacts that we're seeing. That Jews are strongly connecting with their ethnic identity, with their Jewish identity, and in doing that are looking for like-minded folks.
Yeah, we absolutely saw the same thing anecdotally. We saw the community really, people just feeling a need to be in community, even wanting just to get together with other
Right.
Jews, right? It was such a really a powerful experience. And actually, when we did our survey, we've done a survey of Bay Area Jewish identity for 3 years in a row, 22, 23, 24. In the I think it was the 24 survey, we asked a question around that in
Mhm.
terms of, attachment to Jewish community, involvement in Jewish community. Definitely 23, 24, those numbers, maybe we also asked it in 23, those numbers went up,
Mhm.
to show that it was really a profound need.
Right.
So I'm curious, how does the data from your survey kind of track with other national data, particularly around mental health? Like, are Jews experiencing more of a mental health crisis right now than other groups? Is it similar? And then maybe talk a little bit about like maybe other groups that have had similar traumatic experiences. You talked a little bit
Mhm.
about experiences of discrimination. So how did the results here track with those results?
So I can better answer your second question than I can answer your first question. So your first question was, how does this, so the study that I did, shoestring budget. I keep saying that in case there's like any any donors that might be listening. Um, but so the sample was exclusively Northern California Area Jews. Um, in terms of how this tracks with other Jewish communities, I know of or national data. I know of another study of a couple other international studies. So I think one in maybe the Netherlands, one I think in the UK, but I actually don't know of any quantitative studies, and it could be that they exist. So it could be that, like something was published and I've either missed it or it came out just recently and I haven't seen it yet. So it's hard for me to say how this maps onto national data. My guess is that with any study, there's some limitations, and selection bias is always going to be a factor. And so, what I mean by selection bias is that the people that want to sit down and fill out a 45-minute survey
Mhm.
about their Jewish identity and anti-Semitism have feelings about Jewish identity and anti-Semitism. And we
Exactly.
do have some folks, I don't count them in the 218. We do have some folks that got partway through and didn't finish. So, you can think, well, maybe these questions just really don't apply to them. You can also think, oh, maybe it's a busy mom, little kids running around, just don't have the capacity to finish. Um, but so my guess is that if we were to look at nationally representative data, the findings would be less profound. We would see less mental health impact. Now, that doesn't mean that anti-Semitism isn't having a mental health impact. What it means is that there is some variability in it, right? It's not impacting everybody. Um, and I think that a California sample is unique for lots of reasons. The sample is largely reform. When you look at national data, Jews, um, the majority of Jews within the United States identify as like cultural secular uh,
Hmm.
Jews. Those Jews are actually, you guys do a really great job with your survey research. Those Jews are hard to find on a shoestring budget,
Hmm.
um, because you can't knock on a synagogue door and find them. And then I think the uniqueness of California is that California is a hotspot, not just for, the rhetoric of what I was talking about on the UC Davis campus in terms of, the more left-wing anti-Semitism, but also a lot of right-wing anti-Semitism, So I think that California and ADL numbers and FBI numbers show this as well. California is going to be unique because people are more likely to have had some experiences with anti-Semitism here than Idaho.
Hmm.
Um, but my guess is that Jews in Idaho have their own unique experiences as well. So then your second question is, in comparison to other groups. In the aftermath of 9/11, of September 11th, there was an increase in Islamophobia and attacks on and discrimination of people who were perceived to be Arab and Muslim. And that had a mental health toll. There are studies that have shown that Arabs and Muslims within the United States had a decline in their mental health in the aftermath of September 11th. Um, it directly related to perceptions of discrimination and Islamophobia, similar to like how I assessed anti-Semitism, because there actually was a national drop in mental health after September 11th, right? That was a national
Hmm.
terrorist attack that undermined the psyche and safety and security of many Americans. And so there was a decrease or an increase in mental health problems and Americans, as far away as in California, you didn't have to be living right in the um, in New York City to have felt those impacts. And then not around specific crises, we see the discrimination on a whole host of identity characteristics. So if you perceive discrimination because of your weight, because of your gender, because of the color of your skin, because of your sexual orientation. There's been studies in all of these communities, and perceptions of discrimination are associated with increased depression and anxiety. And so, in that sense, you know, I was talking shortly after this study came out. a reporter kind of asked me, like, what's the big takeaway? In my head, I want to say the big takeaway is that Jews are people too. Like the things that hurt other people hurt Jews too. When bad things happen to other people, it impacts their mental health. When bad things happen to Jews, it impacts our mental health too. And so, to me, what this study does is it shows that the same things that we know happen to other communities happens to Jews too. And it's sort of that like, believe Jews. For me, it's that believe Jews moment.
And we've often had that moment where we felt gaslit or had
Right.
our experiences invalidated, right? Because, there's this perception that, either anti-Semitism isn't a serious problem or it's resolved, or Jews, we have, all of this collective power in this country. This is a stereotype, right? That we can just take care of anti-Semitism ourselves. We don't need the community. And your study showing that's exactly not the case. We need
Right.
help just like everyone else.
That's right.
Yeah.
That's right. Jews are
So
people too.
exactly. I love that. So what do you think the long-term implications of these increased mental health impacts are on families? And in particular, I don't know if you can go down to talking about children since obviously you interviewed parents, but
Mhm.
what do you think the long-term implications are?
Um, so I do have measures in there, and so I have another paper under review now that is looking at that intergenerational piece. So I can speak a little bit about kind of a pathway, but I don't have, as you said, I didn't collect data on kids. That is my next, I hope for one of my next studies as well. Um, so one of the, one of the shocking things that data points that I saw within our study is that parents are reporting a threefold increase in encouraging their children to hide their Jewish identity from before to after October 7th. A threefold increase. That that is shocking. That shows the deep concern that parents have about anti-Semitism, in particular safety concerns for their kids.
Hmm.
So in long-term impacts, I think that that we're it's right now, it's hard to say what those long-term impacts will be. But I do see within the data an increase in parents socializing Jewish identity, meaning that they're doing more teaching.
Hmm.
It's more important to them that their kids know that they're Jewish, that they understand that they're Jewish, they know Jewish history, they know Jewish culture, that they are involved in Jewish practice. At the same time, right, there's this, this other piece, like I said, this threefold increase in hiding. And so I don't think that actually maps on well to any other community.
Mm.
So it is something that we see in other communities that when other communities, when Black communities experience anti-Blackness and racism, they teach their kids how to respond to racism.
Mhm.
Teaching them to not be Black or to hide their Black identity is not an option. Now
Mhm.
there's a literature around code switching and how to engage in white spaces, but that's very different than don't tell anybody that
Yeah.
you're Black, right? And that's something that we are seeing within Jewish families. Now, how that will end up impacting Jewish kids' mental health, how it will impact parents' mental health to know that this is the world that they're living in, where they feel the need to teach their kids to do that. Um, I don't think we know what the combination of it's really important that my kids know that they're Jewish, and it's really important that they know when to hide it. I don't think we really have a good sense of the long-term implications for that.
Thank you. So I want to switch tracks a little bit. So the organization I work for, JCRC Bay Area, we work with Jewish individuals and families across the Bay Area. And as we've talked a little bit about already, we've heard many stories of families really struggling over the last couple of years. The survey that I mentioned before showed that 17% of those who took our survey reported that they made major life changes due to anti-Semitism, like switching their kids' school, changing jobs, even moving, changing locations, even moving across the country in some cases. That's a huge impact of anti-Semitism. We alluded to this earlier, but we found 55% felt less safe in their day-to-day life than they did before October 7th, and 40% have felt excluded at times because they're Jewish. We've also heard stories of things like microaggressions, dismissiveness, lack of understanding, and even hostility from mental health practitioners toward Jewish and, in particular, Israeli clients, who I think are even doubly impacted.
Mhm.
And some community members have even hesitated or avoided seeking mental health care out of concern about experiencing anti-Semitism. So, my question is, do you think the mental health needs of Jewish families are currently being met? And if not, can you talk about what do you think needs to happen to kind of change that, to move the needle forward to get their needs met better?
Yeah. Um, so I have a lot of thoughts here. So excuse my ramblings. So the short answer is no. The mental health needs, the needs of the Jewish community are not being met.
Mhm.
And now I'll start to ramble into my long answer. Um, so I think both sort of within our community, within the Jewish community, and then broadly, outside of the Jewish community. So I will first, but there's overlap and spillover, but I'll first focus on kind of the within piece. And um, so I mentioned that I'm a stress researcher, but I'm a family stress researcher, and so I my brain just always goes to supporting families. Um, and and I think we need to do a much better job of meeting families where they are at. And I mean that both mentally and physically. And the reality is that um, families are really strapped in this day and age, and that's not just Jewish families. Um, modern families are stretched far thinner than we've ever seen before. And in terms of most families need to have two incomes in order to support their families. Kids have multiple activities. Parents need caregivers before or after school, daycare starting at a young age. Cost of living is skyrocketing. Generations of families are spread across states, across the nation. Internationally, you mentioned Israeli families. They probably have family, in another country,
Mhm.
and that's actually more and more, the norm of families. And so I think what we really need to be doing is figuring out how we can engage with families in a way that is actually feasible given all of the pressures that they are facing, because the reality is that we cannot expect to send kids to Sunday school for 2 to 3 hours once a week from 5 until 13 and hope that that very small amount of time is going to instill what it means to be Jewish, Jewish pride, Jewish history, Jewish culture, Jewish traditions, and history of anti-Semitism, contemporary anti-Semitism, how to respond to anti-Semitism, right? We need to support families in those efforts to do that. Right. We cannot offload that. We can't expect that that is, and I think making Sunday school and camp more financially accessible is huge. But even that's not enough, right? We need to support families to be integrating this into their daily life. How to have conversations around the dinner table starting at a very young age. So these conversations need to be happening at home. Um, Kids need to understand, they need to know that that being Jewish is important to them. And it's something that is, again, part of their daily life. And that can look, and I'm not saying that that has to look exactly like this. And so we also need to be able to meet the diversity of families' needs and what it means to be Jewish so that families feel like they can be bringing their identity into their home life in a way that feels comfortable and accessible for them. And we know that this is, from other communities, we call this cultural resilience,
Hmm.
right? This is a resilience factor that we can give to our kids when our kids have pride in who they are, when they have knowledge about who they are, it actually protects them against mental health harms. It makes them feel more, safer and more secure in their identity. And we know that they will have insults to their identity. And so helping parents strengthen their children's identity, it needs to be kind of in the forefront of the conversation. So that's a within piece. And this maybe is still kind of a within piece, but I think also is is non-Jewish focused, which is that we need to have substantially less debate around the definition of anti-Semitism. Now, that isn't to say that scholars can't be having these important definitional debates, but we simply do not see the obsession around defining hate for other communities that we see in non-Jews attempting to define anti-Semitism. Um, and and so I sort of see a couple of reasons on why we really need to push back on these definitional debates. I just see them as sort of like just a distraction. It's part of what you were saying is it's giving somebody license to dismiss the impact. Is by saying, "Oh, that thing actually isn't anti-Semitism. That thing that made you scared, I don't care about it because I've decided to define that not as anti-Semitism." You know, that's
Hmm.
absurd. That's gaslighting. It's invalidating somebody's trauma.
Hmm.
So, one just very simply, the people that should be leading the conversation on Jewish pain and Jewish oppression and Jewish fears and anti-Jewish rhetoric are Jews. It needs to be Jews.
Hmm.
And we should respect this for every minoritized group, right? That every group gets to define their own oppression.
Hmm.
Um, but we also need to move away from these definitional debates. And again, this is kind of like now the outside thing is that this is not how we respond to public health to any other type of public health crises. The way that we respond to a public health crisis in sort of a public health framework is that you first identify that there is some health problem. And so, you know, I did
Hmm.
that. I did a study. I have identified this to be a problem. Jewish mental health is a problem. So we've identified the problem. Now, what we need to do with the public health perspective is figure out what predicts that problem. We don't start by saying, okay, here's the definition. Whether or not that maps onto the problem, it doesn't really matter. This is what I'm now defining as the problem. No, that's not how we, approach anything. Effective public health interventions focus on reducing harm, not going round and round with definitional debates. And so now that it's clear that Jewish communities are hurting. We need to be doing studies to understand what are these factors that's really undermining Jewish safety, security, and mental health. And then to move the needle, we need to take that information and we need to infuse it into all of our systems. We need to train therapists to be knowledgeable about anti-Semitism, about what it is that creates this harm. We need to train therapists to start from that place of believing Jews, of validating that harm. And I know the next speaker in the series is going to be talking more about that.
Hmm.
But we also should be um, creating educational interventions that whose foundation is
Hmm.
built off of what we understand to be the most harmful, like the things that undermine Jewish safety and security. That's what we need to be working on educating people on to prevent, right? So that might look like, bridge building, community dialogues. It might look like, educational programs that go into schools. And then, I'm a scientist. We need to be evaluating these interventions. We can't just come up with some educational program, slap it in a whole bunch of school systems, and then when we have, you know, five alarm anti-Semitism fires, and we go, well, I just don't know because they actually had a Holocaust class or they actually had, anti-Semitism education. It's like, well, okay, well, it's not effective. We need to
Hmm.
do better at making sure that whatever it is that we are investing in, that it's effective, that we are doing those program evaluations constantly. And so that
Hmm.
as things shift and change, right, we cannot have anti-Semitism education that worked in 1963 and expect it to work in 2033.
Hmm. No, absolutely. And the bill that created this Holocaust Collaborative for Education was created exactly to address that because we know every school system, not just school system, every school system, every school, and then every teacher teaches about the topic differently.
Right.
And many times it's not necessarily effective. It's not getting
Right.
across what needs to get across. And
Right.
so really kind of, upping their game, doing a lot of professional development, a lot of education is really critical. And I think applying that principle across other topics around Jewish. We know that also Jewish identity in public schools barely shows up. It shows
Right.
up in the Holocaust.
Yes.
Maybe it shows up in sixth grade when they talk about ancient Israel.
Right.
And that's and maybe around the Israeli-Palestinian conflict, but there's
Right.
no real discussion around modern Jewish identity, around Jewish American identity and Jewish stories, and around what contemporary anti-Semitism looks like. So that's absolutely needed, and it makes a lot of sense.
Yes. And
So,
there I think it was in Dara Horn's People Love Dead Jews book where, she came across somebody that was surprised that Jews were still alive. And that is not the first time that I've heard that. When I read that, I was like, oh my gosh, yes, that's something that I've heard other people say too, right? And it goes back to what you're saying is that, in our public school system, it's um, it, Jewish history is sort of plugged in as sort of like pieces of plot lines um, to for somebody else's plot, and so it's really disconnected. There isn't any arch to understand, what laid the groundwork to even get into the Holocaust, right? The way that students learn about the Holocaust is typically stepping into maybe World War One, but most likely into 1930s Germany, and that's completely detached from the
Hmm.
entire history of Europe up until that point.
Hmm. Hmm. Yeah, makes sense. So, I have one just a set of questions left, and then we'll turn to the question and answer. We have a number of questions in the chat. I do want to ask a little bit of what you were just talking about. You had shared in a J Weekly op-ed. So I'm going to ask Rebecca if you could share that, if you haven't already, in the chat, so folks can learn and read a little bit more about what you were talking about. So, curious about the future. So you've talked a little bit about this and kind of hinted, what else could be helpful from a data perspective to really understand this situation. So talk a little bit about that, and then it sounds like you have some other things in the works. So tell us a little bit about what you have in the works, and is there any way for people on this call to be part of that?
Yes, thank you so much. So I talked a little bit about how with this study, we really there is this impact across October 7th, but that really is driven by experiences or concerns around anti-Semitism. I am interested in looking at this sort of zoning in on October 7th and the potential traumatic impact of um, October 7th, specifically on moms who had babies immediately before or right after
Mhm.
October 7th. We know that pregnancy and the postpartum period is a vulnerable time for mental health problems. We also know that that time is a particularly important time for social support. And so I'm interested in learning more about how, new families that were just starting during this time were uniquely impacted. And then also thinking about how they are envisioning raising Jewish children, knowing that they, are bringing children into this world. Many of us brought children into a previous world and are playing some catch up to get them into the world we're in now. But better understanding how parents who are having babies in this world are navigating that in terms of what their hopes are for their kids and what they're seeking out for their kids in terms of Jewish experiences and identity. And so that is a study that's focused. Right now, I am going to start recruiting, and so you're welcome to drop that link into the chat of the questionnaire that is for that study. And I'm first focused on babies that were born in that year right before October 7th. So from September 2022 to September 2023. And then I will end up expanding recruitment. Right now, I just want to get as many of those families assessed as possible. And then I'm going to expand recruitment to get babies that were born in kind of the immediate aftermath of October 7th. So that's the first study. And then in partnership with JCHMI, the Jewish Community Mental Health Initiative. Our hope is to look at adolescent mental health, and that was kind of some of what you were poking at too. And I don't know of any studies right now that have focused on teens and teens are, just like I said, that, pregnant moms, new moms, it's a vulnerable time in terms of mental health. Teens, that's a vulnerable time for identity development. We know that adolescence, like that is the main sort of, big thing that adolescents are working on is figuring out who they are. And so teens that are figuring out who they are in this world right now are going to have unique implications. And so focusing a study on teens, and that's going to be teens that are 12 to 18, so that sort of early teen to later teen time. And I don't have a link for that. That's not off the ground yet.
Great, thank you. That's great. It sounds like a lot of, you're really starting. There may be a lack of research, but it sounds like things are going to start to pick up, and hopefully, in a few years, we'll have a clearer picture of what's going on and what we need.
Yes, absolutely. And I'll just say a concern of mine, though, in doing this work is that it's possible that Jews are the only ones who have an appetite for knowing this research.
Hmm.
Um, and I feel very lucky that that first paper, the paper that we're talking about, the mental health paper, actually ended up in a premier psychology, APA psychology journal. But the other papers, I've struggled to get into a non-Jewish specific journal, and I think that is going to continue to be a problem. Is that there is going to be sort of a sidelining of research in this area.
I think that's a symptom of the problem, right?
Yes. Yes,
Yeah.
it is.
Okay, so we have a lot of questions and they kind of fall into different categories. So let me start with kind of actually, let me start with the first one, which is a question I can answer, which is, will we share the links and resources in a follow-up email? Yes, we will do that. The other questions fall into a few categories like, sort of questions around the data and around your, who you collected data from and that. So I'll ask a couple of those, kind of bunch them together, and then I'll move on to there's some more around like more around both implications and some other pieces of the findings. So um, one was around, were you able to attribute a source of anti-Semitism that was felt by Jews? So left-wing anti-Semitism, right-wing anti-Semitism, anti-Semitism versus anti-Zionism, like where was it coming from? And did that impact any piece of your study? And so that's one question. If you can just let me just ask a few to get it
Yeah.
out. The second, if you could, okay. So the second one is, how did you determine or define Jewish identity among participants in the study? I think I know the answer to that one, but I think it's good
Mhm.
to mention that. And did you find the data varied among the different ages of the kids? So the families that had kids, young kids versus teenagers versus older kids, how did that data potentially vary?
Yeah. Excellent questions, great questions. Um, so in terms about thinking about where anti-Semitism is coming from, with this study, we did not differentiate. The question was around concerns about anti-Semitism, and so we didn't ask people um, to try and differentiate or tell us This is more of a concern or this is less of a concern. Um, we just asked about, how concerned people are about anti-Semitism and let people define that in their own way. And I think that there's some pieces there that we need to kind of follow up on, and there's some pieces there that I think are kind of important in their own right. Is that this I think, like I said, understanding what it is, what is the rhetoric, what is it that people see that is undermining mental health? That is sort of the next generation of studies that we really need to. And I do have some data, um, but not great data
Mhm.
to do that. Um, so I asked some questions around basically how on a whole bunch of different things, how anti-Semitic do people think their community members are? Um, I didn't ask, do you think this is anti-Semitism? Do you think this is anti-Semitism? But I think that that's really needed for Jews, that
Mhm.
Jews need studies where we get a chance to say, this scares me. This doesn't scare me.
Mhm.
This is the type of rhetoric that, makes me concerned. This is why. That this to me is falls within, totally fine critique or whatever.
Mhm.
And then this doesn't. But I that's not what this study did. I did ask, how concerned are you about anti-Semitism? And then I asked, how concerned are you about anti-Semitism as it pertains to critique around Israel, or some, I can't remember exactly how it was worded.
Mhm.
Um, People indicate not being as concerned, but still deeply concerned, and that variable has very similar impacts on mental health. So that's why I just collapsed it into this sort of like general concern about anti-Semitism rather than sort of, like I said, I think the next
Right.
studies are teasing these pieces apart. Um, and now I have forgotten
How did you the next one was how did
okay.
you determine
Yeah.
Jewish, yeah,
Yeah.
participation?
Many, many, many questions. So, we asked there is a standardized questionnaire about Jewish religious and Jewish cultural practice, and so I used that standardized questionnaire. It's about 10 for each, so it asks questions about like, do you regularly go to mikvah? Do you cover your hair? Do you light candles on Shabbat? Do you regularly read from the Torah? Um, do you wash your hands before eating bread? Like it's a whole bunch of strictly religious questions. And then there's another questionnaire that is strictly cultural. Like, do you listen to Jewish music? Do you read Jewish literature? Do you seek out Jewish news outlets? Um, I'm trying to think of some of the others, but we ask questions around both. And then we also ask a whole bunch of questions around like pride and identity. So it's questions like I spend time learning more about what it means to be Jewish. I prefer to be around Jewish people. Um, I'm proud to be Jewish. Um, when somebody is convicted of a crime, I feel embarrassed if they're Jewish. But
Mhm.
it's, all of these different ways that people connect with Jewish identity, And so we really tried, again, the kitchen sink, we really tried to capture a lot of different ways that people feel and identify with being Jewish.
Mhm. And then the final piece of that was, did you find the results vary among family age? So young kids, older kids.
That's a great question. So I'll quickly say that which is not answering this question. In terms of anti-Semitism and Jewish identity, we saw really an increase in around pride and identifying as Jewish, and cultural practice. Did not see as much of an increase around religious practice. That was not your question, but I just wanted to quickly say that there's some nuance there with how anti-Semitism impacts identity. Um, in terms of kids' ages, that's a great question. It's a complex question because most people have more than one child.
Right.
Um, so, we recruited from participants who have kids from 2 to 18, residential kids between 2 and 18. Um, again, this is not totally answering your question. What we found is that most people start talking about anti-Semitism to their kids pretty young. Um, Around 5 to 7, but they start talking about present day anti-Semitism later. So they're having conversations around like the Holocaust and historical anti-Semitism much earlier. They're having conversations around contemporary anti-Semitism later. My guess. Is that some of that has to do with resources that parents have access to. And so again, this kind of goes to parents need to have the tools to be able to have these conversations. But I don't know, how parents of kids of different ages are responding. I just know how like when people start engaging with their kids around anti-Semitism.
Right. So we're getting close to time. So let me just ask you one final kind of group of questions before we close. And these were really, we had a few questions around, um, not directly related to research, but directly related to implications and what is this? What can I do, or what can somebody do? So, for example, how can I help my child feel less fearful,
Mhm.
particularly about wearing their, kind of Jewish identity? In the public space, or and questions around what is needed to help the community heal,
Yeah.
and is focusing on healing something really important for mental health. So if you just want to weigh in on those two, and there were a lot of great questions, and I'm sorry we weren't able to get to them, but please.
Um, yeah, this, I think when talking about individual families and individual kids, I defer to parents. Parents are the experts of their own kids and what their kids need. So I wouldn't want to encourage anything that like just doesn't feel comfortable for a parent. But I my you know my own son got a death threat in seventh grade for being Jewish, and has had multiple anti-Semitic situations, incidents. There was a time when he took off his Star of David, and you know, I'm not the one that's living in his skin in his school. And so I support him to take it off. If that doesn't feel comfortable for him, I can talk to him. I can ask him questions about it, what it means to wear it, what it means to not wear it. How does it feel to take it off? How does it feel to put it on? Are there situations where he does feel comfortable wearing it? You can initiate those types of conversations. Um, I mean, there's situations. I wear a star. Can't see it. I wear a star all the time. However, there are absolutely times when I have been out in, backcountry somewhere and need to stop and get gas, and I will tuck it into my shirt before I step into that gas station. So, it, I think it's maybe what it is teaching your kids about, situational awareness.
Mm-hmm.
Um, and is it really a safety concern? Are they is their physical safety jeopardized? Or
Mm-hmm.
is it they don't want to, deal with comments, right? Where they're not gonna get hurt physically. They don't want to deal with navigating anti-Semitism. And I think those are very different conversations because I think we can help give kids tools where they feel more confident navigating those conversations. Whereas if they are in a physically threatening situation, I personally would not encourage my child to step into a physically threatening situation. Um, and so I wouldn't expect other parents to
Mm-hmm.
do that either. So I think a lot of it too is modeling, you know, um, modeling how you show up as a Jew in public spaces. And my kids know that like I'm like a super proud Jew. I'm like a big, big Jew. And whatever that means, but my kids know that like I wear my Jewish identity and I think that part of that is that I am known on campus.
Mm-hmm.
Um and that has been a learning experience of how I navigate that. And again, it's talking to my kids about what that means for me and what I feel comfortable for myself. Um, but making sure that my kids have the tools where they can make good, safe choices for themselves.
Mm-hmm. And just on healing resources or healing as a priority to address some of the crisis.
Yes. I um I don't know I don't know exactly what that means. I don't know exactly what that looks like. I mean, I think that like being for being a proud Jew, feeling good and strong about who you are, connecting with other Jews, being in Jewish spaces, um, being the Jew that you want to be. I'm not saying like all of a sudden you need to change your religious practice, but but feeling a strong sense in your own identity, whatever that means, whatever your identity is, and feeling, um, efficacious in that pursuit. I in terms of the data, like we know that ethnic pride is a buffer for experiencing discrimination and buffering the impacts on mental health in other communities. And I have no reason to believe that it won't be an important buffer for Jews as well. And I think, making sure that you have a therapist that you feel completely comfortable in talking to about all aspects of your identity and health.
Right. Thank you. Well, I feel like there's so much we didn't get to discuss, and maybe this means we need to do a part two
You know where to
conversation.
find me.
So thank you
Absolutely.
so much. This was just really informative, and I hope it was really helpful for everybody in the community. We have, as we've already mentioned, we have another session coming up and February 12th with Dr. Joshua Simmons, and he's going to be focusing on the more of the like the mechanisms, the psychological impact of anti-Semitism on Jews. So stay tuned to that, and we will send out again. We'll send out a list of the links that we've talked about, as well as a list of resources around mental health. So that you can access help if you need it. You can read more, learn more, educate yourself. So again, thank you, and have a great evening, everyone.